Yeah, so thankfully and luckily, El Paso has been spared due to some of the amazing work the county and city has done around vaccinations. But in Austin, Houston, Dallas, major metropolitan areas of 7 to 10 million, they're running out of ICU beds. As you said, Austin has 2 ICU beds left. And so this is really disappointing that we're experiencing what is this surge again after what we went through last year. We've had robust conversations about this, but I think it really is where people and parents have to understand that politics and politicians are getting in the way in this case. They have to take that personal responsibility. I have an 11-year-old and a 14-year-old. One can get vaccinated, one cannot. They wear a mask every day to school, and I expect them to continue to wear a mask. If you're a parent, send your kids to school with a mask. That's the best way to protect them if they can't be vaccinated. If they can be vaccinated and you're on the fence, this is the most dangerous time to be unvaccinated in America. And I think you have to really take a strong look at why you aren't vaccinated. I think the people that are coming into hospitals across our state, and as you know, across the country, are predominantly unvaccinated. And so we need to find a better way to get people to understand the dire circumstances this Delta variant actually faces them with their unvaccinated. I think each school district and each school board has to take their local sort of dynamics into their own hands, right? I think that one of the things that I've said to multiple school boards across the state is if you really want to protect my children, get everybody in your school vaccinated. And then that layer of protection. I think the other thing that we have to remind people about is a mask is not a mask. Right. At this point in time, we don't have a shortage of masks. And so if you're sending your kids to school, it should be a KN95 or an N95. I don't believe a cloth mask cuts it at this point in time, especially with the Delta variant. And I think that each school district has to take that responsibility onto their own selves. Not all of the county and city health departments are tracking it. What we are seeing is that there's a range of about 90% to 98% of the persons that are in the hospitals are unvaccinated. Some sort of back of the envelope and anecdotes and talking to colleagues across the state put the percentage of breakthrough infections in the hospital at maybe 1 to 3%. So again, you're seeing a huge break or a huge dissonance between vaccinated and unvaccinated. And that's really why my pitch is to anybody listening right now. If you're not vaccinated, this is the right time to get vaccinated. The Delta variant is more transmissible, more contagious, and we're putting a stress test on this by sending kids to school. Get the right masks and get vaccinated. Because one of the things that happened last year is that this is regional. And so Texas surged, Florida surged, the Northeast, the Northwest, and we're always able to sort of pull staffing from other parts of the country. As you know, Governor Abbott has asked other healthcare workers to come into Texas to assist us. The problem is that from Texas to Florida, if you look at the heat map that the CDC presents in the New York Times, it's really difficult. Everybody's experiencing a massive surge. And so expansion of hospitals, you're going to see tents. And unfortunately, this is not a good time to be sick in the hospital if you're unvaccinated. And so it'll probably take at least 2 to 3 weeks for this surge to come down. And in that 2 to 3 weeks, even if we start to surge vaccinations right now, we may not be able to protect enough people. Getting those vaccinations protects people, and we can hopefully avoid a future surge. I have an 11-year-old who just started 6th grade in middle school, and so he knows the drill. He has a mask. He has a KN95. If it gets soiled, he has multiple other masks in his backpack, and he has some surgical masks in case the day goes out of control. I think any parent is going to be worried. We're putting an immense stress test with a variant that's at least 2 to 4 times more transmissible. And so this is where the CDC and the FDA are going to have to make some decisions about what do we do with pediatric vaccines. We've seen in other countries that kids didn't seem to be as affected. However, they also had populations that had a lot more vaccination penetrance across the board. And so this is a scary time to be a parent. It's a scary time to be a child. And so but at the same time, go for it. Yeah, so as you know, the American Academy of Pediatrics wrote an open letter to the FDA asking them to approve the vaccines under an emergency use authorizations and continue that tracking. There's been some controversy with that because there are people that say the safety signals have to be gotten right for kids that are under 12 because of the concerns about myocarditis in the past. I think we're in a tough situation. I think that we are in a place where the FDA is trying to do the right thing and they're getting buffeted by both sides. If you're a parent, you really have to focus on getting the right mask and hoping that your school district can improve ventilation and potentially improve spacing in your schools.